Hello, Ms. Calviani, fellow students and friends. My name is Eileen Pereira. I'm here to present to you the illness called pertussis or whooping cough. Now, in the next few slides coming, we would get to know more about pertussis or whooping cough, how it's transmitted, signs and symptoms, stages of this illness, length of communicability, control and preventive measures, childcare policy, and non-traditional medicine. Now in the next slide, we will be able to hear how pertussis sound like. Now what is pertussis? Pertussis or whooping cough is a highly communicable bacterial illness caused by the bacterium called Bordetella pertussis, which infects the airways. The person exhibits heavy coughing followed by high-pitched when breathing in like crowing or whooping sound. There's usually that feeling of vomiting after coughing. Now, how is it transmitted? The illness is easily transmitted through direct contact or droplets from coughing or sneezing. Indirect spread through objects around that are exposed and not sanitized, where bacteria can stay and easily be contracted by the next host. It can wipe out the entire household, leaving babies vulnerable. What are the signs and symptoms of a person who has pertussis? The infection usually starts like a common cold with symptoms such as runny nose, sneezing, mild fever, and mild cough. In babies, pertussis can cause apnea or pause in breathing. Unvaccinated or undervaccinated young children are affected severely with debilitating cough that would run for weeks, and laborious breathing due to constricted airways. What are the stages of this illness? According to my research, there are 3 stages of pertussis. The first stage is called catarrhal stage, which exhibits runny nose, sneezing, low-grade fever, and a mild cough, similar symptoms as having colds. This stage would run for a week or 2. The second stage is the paroxysmal stage, which develop showing bursts of rapid coughing. Inspiratory wheezing occurs when you inhale and vomiting. This stage may last for 6 weeks, but may persist up to 10 weeks, about 2.5 months. The last stage is called convalescent, which is the recovery stage. It is gradual and may take weeks to months. What is the length of communicability? This disease is highly infectious for up to 3 weeks from the start of the symptoms if not being treated with antibiotics. It can run its course for 5 days if appropriate medication is taken. The catarrhal stage is when it is very infectious. What are some control and preventive measures in place? There are some ways we can keep this disease at bay. One way is frequent hand washing with soap. Prevents the virus from spreading or entering our body. It is inevitable that germs are everywhere and can live on surfaces for some time, which means every school or program should regularly clean and disinfect the entire area, especially those objects that are frequently in contact with children. We must encourage children and even staff members to use cough buckets or cover nose and mouth when there is a need to cough or sneeze to contain the virus and reduce droplets and airborne viruses to spread. Advise staff and families to isolate themselves or stay at home when they feel sick or children are not feeling well to prevent an outbreak. Pertussis is a vaccine-preventable disease. This vaccine is combined with other vaccines so that your children or your child can get protection from other several illnesses, resulting to fewer shots. So get vaccinated. Make sure that the children's immunization records are up to date. Do not give your child over-the-counter medication. And report this incident to your school so they can have any safety actions procedure inactivated. It is also imperative for you to consult your doctor or healthcare provider so they can give you the accurate medication to help you fight this illness and get better in a timely manner. And in my handout, I have a list of vaccines and what age they are administered. So please go through it. Just to name a few of the vaccines that are authorized in Canada: the Adacel, Boostrix, Infantrix. Now, what is the child care policy in this illness? Children with pertussis or whooping cough should stay home to prevent the spread of the disease. The child can return to school or child care 5 days after they begin the treatment with antibiotics and only when they feel well enough to participate in any school activities. How does non-traditional medicine treat this illness? In my research, there are no alternate or non-traditional medicine that can treat pertussis. However, some supplements and herbs can be used to strengthen their immune system. But before doing so, the person must confide with their family doctor to make sure that it is not working against the antibiotic prescription given to them. Please check out my handout to see all the list of herbs and supplements that were recommended. To name a few, some echinacea, an expectorant. You could use hyssop, anise, and helicamp. Some antispasmodic, catnip, chamomile. Homeopathy. Though there are a few studies that have investigated the effectiveness of some specific homeopathic therapies, homeopathy does not treat pertussis. It is only a supplemental treatment for you. You need to seek advice from a professional homeopath to assess and determine the right treatment to be taken. So I have also a list of homeopathic medicines in my handout, and please check it out. And there's also physical medicine, such as chest rubs, like Vicks Vapor Rubs. So do not make the mixture too strong, as it could irritate respiratory tract. And do not give essential oils orally, as they can be lethal. And also use of humidifier. I think you have this in our house. I have this in my house. So humidifier paired with essential oils is very helpful for clearing or just loosening up our breathing or airways. So this ends my presentation. I hope you learned something, and please leave me any comments, questions, or feedbacks after. Thank you so much. Bye.